Doctors at the Kakamas hospital in the Northern Cape have called on farmers to change farm workers' working hours. 7 people have lost their lives in the Lower Orange region due to heat stroke. Let's discuss the do's and don'ts. We're now joined via Zoom by Professor Feroza Motara, the president of the Emergency Medicine Society of South Africa. Prof, a warm welcome to you. Thank you so much for joining us.
Good afternoon, and good afternoon to your viewers.
Prof, let's talk about what exactly heat stroke is and how you get to the point of suffering from a heat stroke. I mean, you know, we've seen the hot temperatures, but at what point does it have to get for you to get a heat stroke?
Okay, so essentially heat stroke is the culmination of a process that starts with something as simple as sunburn or heat rash, and progresses the more you expose the person to heat and the sun, and working or exercising in that environment would aggravate that. So you get to a point where your temperature gradually goes up.
Yeah.
Obviously, because of the exposure, you sweat profusely, and the more you sweat, remember that as you sweat, that sweat evaporates and is a body's internal mechanism of cooling.
Yeah.
But when you get to a point where you can't sweat anymore and you're dehydrated, your body then goes into shutdown. It affects a whole lot of organs. When it starts affecting your neurological system and you start getting confused and you have fits and you lose consciousness, that at that point becomes heat stroke. And Prof, that becomes a medical emergency.
Prof, one would think this is easy to deal with. I mean, would one not just be able to perhaps maybe move into the shade, drink some water? I mean, how do you deal with that?
So essentially, those are the management. That's essentially what you should be doing. Remember, in order to prevent heat stroke, you wear light clothing. Don't wear anything that's really heavy. Ideally, if in the case of the farm workers, you'd want them not to be exposed or at work between the hours of 12 o'clock and 3 o'clock, because that's when the sun is obviously at its hottest. You want them to have enough fluids to drink constantly. If they start developing symptoms, the easiest thing to do is to remove them from that situation, put them in the shade, cool them down, give them enough cold fluids to drink, put a fan on if you have access to one. Simple things like that would already start reversing those symptoms.
And what's the difference between heat stroke and what some have called heat exhaustion?
Okay, so heat exhaustion is almost a precursor to heat stroke. And as I said, it's part of that continuum of developing heat stroke. And the symptoms essentially are a progression. So you get cramps, you get nausea and vomiting, you get a headache, your heart rate goes up, your breathing gets more rapid. And as that progresses, if it's not stopped at that point of heat exhaustion, it will then progress to affect the nervous system, and you start getting the confusion and the delirium, and the loss of consciousness. That would ultimately then culminate. And if that is not treated, essentially your body then goes into organ failure, and that's, where you're at risk of dying.
Prof, I think you had touched on it briefly, but just, in closing, some of your comments and advice to South Africans who are in places that, are particularly hot. And, of course, as we all believe, we are experiencing this particular heat wave. What's your advice then?
Right. So prevention, I think one of the very important things I must say to the public out there, do not lock your children or your animals in a hot car on a hot day. It's a recipe for a disaster. The other things obviously is to wear light clothing, avoid the heat exposure, as I said, between the hours of about midday and 3 p.m. when it's at its hottest. Drink enough fluids. Obviously you don't want to be exercising excessively. And then there are other risk factors to avoid. Things like excessive alcohol and caffeine intake, which aggravate dehydration, would make it worse. People who are on certain types of medication, things like diuretics, that you use to treat heart failure, antihistamines, beta blockers and ACE inhibitors, which which we use to treat high blood pressure, those would all aggravate dehydration and the heat stroke symptoms. So just to be mindful of that. Obviously, people who have underlying illnesses such as high blood pressure, heart failure, diabetes would be more at risk. And then people who exercise excessively in the heat, people who are obese are also more at risk. And then the extremes of age, very young children, because their thermoregulation mechanisms are not fully developed yet, and elderly patients because their thermoregulation mechanism starts slowing down as we age. So those are the people that need to be very careful, and then obviously to avoid it. And if you start developing symptoms, obviously take a step out, fluid, cool down. And if your symptoms are not improving within 15 minutes to half an hour of having done those things, then obviously get to an emergency unit.
Prof, we appreciate your input and certainly that advice that you've given us then this afternoon. Much appreciated.
It's a pleasure.